Hello, good evening, everyone. Recently, we had the September Section 1 exam. Before that, there was the July Section 1 exam. And whenever there is a Section 1 exam preparation, most of the candidates, they spend a lot of time studying the guidelines, the Oxford, the scientific basis, and they cover everything from oncology to pediatrics to female urology and urodynamics, everything you study in detail. But one important question that I'm frequently asked about how to address these questions related to the ethical scenarios and how to talk about the statistics. Like there is a lot of questions. Sometimes you can expect 10 questions, sometimes you can expect 15 questions. It's a so it's not a major bulk of your exam, but when you are not very sure about your core urology's answers, then this ethics might decide your pass and fail sometimes. So you should be able to know what exactly are asked in the ethical scenarios and how can you approach these ethical questions. Okay. So what I've done now is for the upcoming course that we are starting from 21st, all the candidates, you had a lot of questions like what to study for that. Don't worry about it. We are going to address all the ethical scenarios that are frequently asked as your exam questions. Okay. Now, what are the sources? Where do they normally frame these questions from? So there are various sources. Sometimes they don't have any source. Sometimes they ask you from your common sense, from your basic science, from your basic knowledge, yours or your basic practice. Okay, they expect you to answer them. Now, there are common resources that are available. Number one is the GMC Good Medical Practice. So in the IMGs, they find it difficult to answer the question based on this good medical practice because they have not gone through it and they are not much aware of it. So it's very important that you read the good medical practice. But is it really possible to read this? The entire good medical practice has been divided into four main domains: from knowledge, from patient care, from your uh, professionalism, and your relationship with the colleagues. And all these aspects are discussed in details in the good medical practice. Now, every domain has a lot of subtopics inside them that can be like it's a lot of volume to read for your exam when you have the whole urology to study. And if you are asked to read all this and find out which can be an exam question and which point can be framed as an MCQ, it's very difficult for you to do so. So what I've come up with, I'm going to include, now I have added a separate class for the ethics where I'm going to pick up the important scenarios based on these domains. So you will understand that the questions that you are asked is actually based on any of these domains. Okay. They ask you questions based on the patient consent, or if the patient refuses consent, what if the patient is a Jehovah's Witness, and what if the pediatric patient, and what is an emergency scenario, and there will be questions like related to research. All the scenarios are basically from the good medical practices. Okay, there are a lot of things. So these are the links available in the website. If you go, you can click and there will be a lot of paragraphs coming up, which will be technically not possible to read for you when you have to read the whole of the urology with. So if you have to just focus on the urology and trust the ethical scenarios, which I'm going to discuss, are going to be more or less sufficient for your exams. Okay. Now, there are other sources as well. So it's not that only the good medical practices are enough. So you can also go through the medical legal aspects of urology. Again, this is a vast topic to study, medical legal aspects. When you have to read the operative urology and the whole clinical urology, the medical legal aspects becomes very difficult to cover and to revise and so all that. So I'm here to help you with that, where I'm going to frame questions based on the medical legal aspects. We are going to include these questions in the mock exams as well, so that we can be acquainted with this scenarios well. This is taken from the Oxford. So anything, any of our section one, and if it is from the Oxford, it can be an exam question. So Oxford is has got a chapter on medical legal aspects, and we should know they include topics on consent, they include topics on the frequently asked questions, and of things related to that that we should be knowing, like Gillick competence and what about a foster mother. So there can be Jehovah's Witness. So a lot of question scenarios based on that. Let us not uh, let us not talk about the questions right now. Let us understand how do we and what are the resources that we have for the ethical discussion. These are some legislation websites of the United Kingdom. So you will find as the UK legislation websites where you will get a lot of information on the based on the legal aspects of the healthcare management. So you will get an idea about that. But again, it's not technically possible for you to go through all of that. Try to pick up important things from those and try to frame MCQs that are like an exam questions, okay? So that will be easier for you to grasp. So what I have concluded that the ethical scenarios that you get in your exam are basically one out of these four, okay? So it's usually the questions are from consent. So you get one or two questions from your consent, like scenario where there will be a pediatric child where the parents are not willing to consent and something like that, or the patient is disoriented, not available for consent, then what would you do? So there will be some scenarios based on that. There will be scenarios based on pediatric care, like there will be scenarios where the child has a non-accidental injury. So in that case, you might be able to very confidently say what is your next step. Then patient not willing to disclose a communicable disease. For example, the patient is suffering from hepatitis or a communicable disease, which is like tuberculosis, and he doesn't want it to be disclosed. What is your role in that case? And professional scenarios like you come to know that your senior colleague, is doing a research and there is some unethical practices involved, then what would you do? So these are the scenarios that you will be expecting, and you should know what to do in what scenarios, and there should be no confusion. So to help you all, I have come up with this extra session on ethics and statistics, and save the date. We are going to start the scenarios from 21st, and we are going to mainly focus on urology. Our whole aim is to focus on urology and cover all the aspects of urology from different resources and make sure that we don't leave out MCQs related to the urology. We had a good feedback regarding the coverage of the topics and coverage of the questions from the candidates. Important is we should also include this ethics and statistics to complete the whole thing. So that's why I have included the ethics and statistics. I'm going to add all the scenarios that are commonly asked from ethical background. So let us hope for the best and don't worry about this ethical scenarios. We are going to have a solution for that. Okay. So all the best and see you soon from the 21st of September. Thank you.